Hi everybody, this is Dr. Sham, rheumatologist from Chennai. So in this video, we are going to discuss about vaccination. See, vaccination is something like it's more of a prevention. So in arthritis patients, particularly with rheumatoid arthritis or psoriatic or ankylosing spondylitis or any diseases like SLE, some of the medications which you use might suppress the immunity. That is how we have to treat it for autoimmune disease. There is no other option. So when you are doing it, we will be worried about certain infections. So vaccination helps in preventing some infections. Then why not prevent it? That is the most important thing. So anybody, usually generally elderly people more than 65, they have to take this influenza pneumococcal. But in rheumatoid patients, particularly on these, not everybody. For example, a patient with gout need not take these vaccines unless they satisfy the other age criteria. But for example, with rheumatoid arthritis or a psoriatic or ankylosing, somebody on methotrexate or biologicals, discuss with your doctor. You have to take an annual influenza vaccine. It has to be usually taken every year. Usually we start it around August, September, like that time, because the winter season in the south, at least south of India, it starts at that time. You ask them to take. So that is an every year vaccine. It's a killed vaccine. So even if you are taking these medicines for RA like rheumatoid, no issues, you can take the vaccine. Then there is something called pneumococcal vaccine. The two types are there. One we call is a conjugate vaccine, which has just once a shot in a lifetime, no need to repeat it. Then you have a polysaccharide vaccine. That polysaccharide vaccine can be given after the conjugate vaccine. That also is depending on the age and other things. It might be a dose of 2 or 3. Then in some diseases, rare diseases like SLE, we have some vaccination called human papillomavirus vaccine that has to be discussed. It's a very small population. People with SLE can discuss, particularly young females can discuss with their doctors. Most of us know hepatitis B has become a universal vaccination, and also tetanus. Remember, all these are killed vaccine. There are something called live vaccines, like zoster vaccine. Now killed recombinant has come, but before there used to be live zoster vaccine. Or people who are going to travel to some continents like where the yellow fever is more common, they might have to take a yellow fever vaccine before going there. Your patient with rheumatoid arthritis, whenever you take a vaccine, first thing ask about your vaccine provider or doctor is whether it's a killed vaccine or live vaccine. Killed vaccine is safe with all the tablets or drugs, but even there are some injections. If you're going to take that and then take the vaccine may not work. So in that case, ideally the vaccine has to be started before taking that particular rheumatoid medication like a biologics. That has to be discussed with your doctor. But with regards to safety, killed vaccines are always safety with all RA medicines. Only live vaccine should not be taken when you are being immunosuppressed. So now with the current pandemic, definitely the vaccination is not going to stop with this. So now we have the COVID vaccine available. There are a lot of apprehensions. I'm not going to in detail. See, in the current situation, I don't think we have a better option than vaccine. Definitely, vaccine has proved most of the patients to prevent moderate to severe infection. Still, we have to follow other things like social distancing and wearing a mask. So it's not about whether you have to take a vaccine or not. You have to ask what all things you have to ask your rheumatologist is, with your current condition, can you take a vaccine? Definitely, they will tell yes. Question is, if you are having an active joint symptom or active disease flare, whether you can take it now or you can postpone. In general, if the patient has a very bad joint symptom, I usually ask them to take it once the joint symptoms get settled. Not for everybody, only if the patient has a very bad flare or if the patient has a life-threatening SLE like that. Vaccine, whether it can cause a disease flare, sometimes post-COVID infection, even in some patients, we do see after vaccine also, suddenly the joint pain can little bit increase. Because we know COVID is more of an autoimmune mediated disease. So with the vaccine also, patients can have flare, but it's manageable. See, because I'm telling there can be a chance of mild flare, don't get worried. Definitely it's manageable. It's not going to be serious. So all patients with rheumatic disease definitely, or they are a priority patients like an elderly people to take a vaccine. So discuss these, whether is it safe, whether you can take immediately or wait on the disease to be controlled, whether there is a chance of flare, and whether you can have to stop any medicines. That is the most important thing. Depending on some of the medicines have to be stopped after taking the vaccine. For some biologics like injections, the vaccine has to be given first. Then after a period of 6 weeks or so, the drug has to be started. So these are the things you have to discuss rather than just blindly telling, I don't want to take a vaccine. So please don't worry. Many of my patients or our rheumatic patients in India, they have taken the vaccine. There are no issues. There some had very rarely, some had some minor worsening of joint pain, but again that was manageable. It was not severe or anything. So this is what you have to discuss. And remember, the vaccines available, Covishield, Covaxin, or Sputnik, or even throughout the world, all are killed vaccines. Sometimes there is a misconception that Covishield, the vector being used like adenovirus vector, people think it's a live virus. There is no live vaccine with regard to COVID vaccine. So the vaccines can be taken with immunosuppressives. So remember that. So the other vaccines, the regular vaccines, plus due to the current pandemic, COVID vaccine also taken priority. So please take your doses. Whether you need a booster or not, there are evidence coming up. Again, patients with rheumatic diseases might be a priority group because they may not be, they are the ones they might be needing a booster dose soon. Maybe that with more evidence comes, we will be able to highlight on that. Thank you.